What's good, YouTube? It's your boy Darius back again with another video, and today we're going to talk about how to survive a nursing interview. Let's get it. Okay, so nursing interviews can be intimidating. I guess the interviews in general can be intimidating. For me personally, I get nervous with nursing interviews. I have now had 2 nursing interviews in my entire life. I've been a nurse for a year. My first interview was at St. Joseph's Hospital here in Arizona for the neuroscience ICU. I got interviewed and then got hired on the spot. I've been a nurse there for a year now, and I like the unit. The people there are great, but I also want to get out of that unit because I want to go to like the medical ICU and then eventually into the trauma ICU. So I was looking at different hospitals, still with Dignity Health. It's just an easier lateral transfer, and I found another hospital that's way closer to home, and I just had an interview there like a few days ago. And so of course, again, this is interview number 2 ever of nursing, and I was just as nervous as the first one because you just don't know what to expect. So I did my homework, I studied, and I'll go over some of the things that I like to look up when it comes to nursing interviews, and I'll give you guys some examples and like what I do. But I did the interview, and that was the first time ever where I did the interview and I didn't know I was gonna get hired right away. So I had like to wait, and I waited like a few hours, and I got the call, and thankfully they hired me on. So I'm 2 for 2 when it comes to nursing interviews. So let me just give you guys a little idea of what I do, and hopefully can help you guys too. Okay, so first things first, go over the job description. What are you applying for? What are they looking for in the candidate? You need to know those things. Then figure out why, of course, you're the best fit for that job. So just some like general questions. They can go such as, why are you leaving your current position? Why do you want to work in this current position? Why do you want to work for this hospital or clinical site? What's your greatest skill? What's your weakness? Tell me about a time you dealt with a difficult patient. What do you think the hardest part about being a nurse is? Your organization. And then just some simple like responses for some of those questions, like what's your greatest skill? Me personally, my greatest skill is I'm an attentive listener. It's very important to listen to what your patients are feeling, what they're saying, and then try to reciprocate a great response back. Show some compassion, empathy. Let them know that you're there with them and you're trying to give the best care possible. Hardest part about being a nurse, it could be maybe feeling helpless. You do all that you can to get your patient as comfortable as possible, provide excellent care, and then there's times when you just cannot do any more. Your patient can be in extreme amounts of pain, so feeling helpless that you can't help them. Why are you leaving your current position? Well, in my case and in other cases, you're looking for new opportunities, new challenges. Your new position could offer you room to grow. Like I was in neuroscience, which was like obviously a specialty, so it's neuro-based. Now I'm going to medical, so I'm going to heart, lungs, cardiac, respiratory, liver, anything. So that's one of the reasons why I want to leave. And then of course, why are you the best candidate? You can say things like, I'm the best candidate because I'm eager to learn, I'm looking for new challenges, I'm looking to further my education, and striving to stay on top of emerging trends and technology. Now some questions that you can ask them back would be, what is the environment like? What is staffing like? What are the educational opportunities? How can you cross-train if that is an available option for you? What is the length of new hire orientation? And what is a typical day structured like? And what I mean by that is, for us personally, in the day shift, I work night shift. In the day shift, you have grand rounds. Some hospitals do it Mondays and Wednesdays or twice a week. Some hospitals do it every single day. So you have pharmacy, respiratory, nurses, doctors, charge nurses, all together walking around, talking about each patient and formulating a plan of care. But before I wrap this video up, guys, what I want you to know, like, the best thing you can have is confidence. Don't go in there scared. Don't let them see that you're scared. And if you are scared, just don't show it, you know? But have confidence in yourself. Have confidence overall. You're gonna do fine. If you don't get one job, there's so many other jobs out there. Just keep on pushing. Keep on applying over and over. Don't ever give up, okay? So I hope these tips help. Just take them and study them. Do what you gotta do, but just prepare yourself for these interviews and then kill it. Alright, that's what I got for you guys. Good luck out there, and I'll see you guys next time.